Hello, myself Dr. Yogesh from Aster Hospital. I'm an Arthroscopy and Sports Medicine consultant. We have finally wrapped up with the IPL and cricket season getting over. Most of the people are enthusiastic to learn more and more about the IPL or the cricket. So more and more people will get onto the cricket the very next day morning telling that, okay, let me start playing cricket. But we should also know what are the injuries that's most commonly associated with the cricket as a sport. So coming from shoulder to head to toe, shoulder injuries are very common in cricketers because of the overuse activities, especially in the bowlers. Too much of overuse activity and the shoulder gets injured very commonly, and even with the elbow. So the elbow also gets injured especially in the batsman, where because of the repetitive use in batting, the elbow also gets injured. The next common injury is hamstring strains, and coming to the knee joint, the most common is ACL ligament or the meniscal tears, and the most common after that is ankle sprains. So every joint or every muscle group is associated with some sort of the injury in cricket, as in any other sport also. Every role in cricket, either it's batting or fielding or bowling, everything has its own different strains to different group of muscle, causing different types of injuries. So how do we avoid these injuries? So very important is to have a thorough warm-up or a regular warm-up, and you have to strengthen specific group of muscles which is intended in that particular role. If you are a bowler, you need to know what muscles you have to strengthen. If you are a fieldman, you need to know what are the muscles you need to strengthen. So strengthening the muscles, increasing the flexibility of the body, and strengthening of the muscles go hand in hand. Both are equally very paramount. And after that is giving rest to the body. You cannot be training every day. You have to ideally train 5 days in a week so that your body gets rest and your muscles gets time to recover. That is very important. And maintaining hydration, which is very paramount, and the most important part is maintaining the hydration. So if hydration is good enough, the muscle recovery is also faster. So these are the things we have to keep in mind so that we don't get injured again and again. And very important is knowing the techniques, how to land, how to run, how to take a sudden turn. So especially when you're sprinting suddenly, the injuries are very common. So you need to know the proper techniques of each role, either it is batting, bowling or fielding. So what are the proper techniques? So learning techniques is also paramount. So with warm-up, strengthening, learning the technique, and using adequate protective gears and hydration, giving rest for the muscles to recover, you can definitely prevent most of the injuries in sports. We need to know the stretching and cooling after any exercise or after any game is equally paramount, because once you stretch, or what is called we cool down the body, then it helps the muscles to recover. It helps in reducing the soreness of the muscle, removing excessive lactic acid that is produced in the muscles, so that the recovery is faster and we have less soreness of the muscles. So generally we do some simple stretches of the shoulder and the elbow, and hip flexors stretching, and extensors stretching, hamstring stretches, and these are the general stretches, especially high leg bent knee stretches to stretch the hamstring, or even the downward dog or the rollover. And you can also foam rolling also can be done to cool down or stretch the muscles. So when you know that you're not able to bear weight on that particular leg or use that particular upper limb, you're not able to move it, or when you're doing some particular action, it is extremely painful, then that is the time you have to immediately visit the doctor. If it is manageable, you are able to bear weight but with some minimal pain, that means it is a minimal sprain or a strain which can be managed by yourself with some rest or some other medications. But if you are not able to walk, if you are not able to move that particular part or the part of the body or the muscle, then you have to immediately consider consulting a doctor. So we need to know what is the difference between a sprain and a strain and a tear. Sprain is when we refer to ligaments. The ligaments, when there's an injury to the ligaments, it's called sprain. But when it comes to muscle, it is called strain. So when you are referring to muscle injury, we call it a muscle strain. And tear is complete tear, whether it is a ligament or it's a muscle. If it is completely torn, then we call it a tear, complete tear. So when do we what do we do when we immediately get a sprain? So when you have a sprain, the first thing is protect the part. So don't move the involved limb too much. And second thing is you have to compress it with the crepe bandage or some elastic bandage like that, and then give rest to the limb and give ice packs maybe very frequently, maybe every 2 to 3 hours for 15 to 20 minutes. You can keep ice packs which will try to reduce the inflammation and the swelling, and also keep the limb elevated. So these are the immediate things you are supposed to do it. And maybe like if it is you are able to bear the pain, not too much of pain, you are able to walk or you are able to use that part of the limb, then maybe you can take some simple analgesics, painkillers over the counter from the pharmacy, so that the pain gets reduced for the time being till the next day. But if you are not able to walk or if you are not able to use that part of the limb, then you have to, instead of going over the counter medications, you can directly go to the consultants and consult them, because there must be something grossly wrong. So this is about muscle strain, sprain and a tear. So when it is a complete tear or a serious grievous injury, definitely you have to consider going to the doctor first rather than doing your own first aid. What are the do's? First is, as I already told, you have to protect the limb. That is, you are not supposed to bear weight, or you are not supposed to move it in any other way, or manipulate the limb in any other way, so thinking that it's going to be all right. So first one is you have to protect the limb. Second thing is you have to rest that part of the limb. Protect as well as rest it. You are not supposed to strain it. So what do some people do? They think, yes, if I walk still more, if I run still more, maybe the pain is going to be all right. That's a very wrong notion. That's the first thing you have to avoid. And then you have to keep some ice packs every 2 to 3 hours for 15 to 20 minutes. That will help in reducing the swelling and the inflammation and also pain. And you have to give some compression in the form of elastic bandage. That will also help in reducing the swelling. And the last is elevating the limb. You have to keep the limb elevate. So how much do you elevate? The limb has to be above the level of the heart, so the swelling comes down. So these are the do's you're supposed to follow within 24 to 48 hours after the injury. So whenever we have a sports injury within 48 hours, what are the things we shouldn't do? So the most common thinking is people either they apply ice or they apply heat pack. So when this is the time you're not supposed to use a heat pack. In acute injuries within first 48 hours, we are not supposed to use heat packs. Why? Because it is going to increase the inflammation and also increase the swelling. So one is heat massage, that is the heat application, that is definitely not to be done. And massages, people usually apply oils or ointments and start massaging the particular part, which is also not preferable, because that is also going to increase the bleeding and increase the swelling as well as the pain. And you're not supposed to consume alcohol in the first 48 hours, preferably, because alcohol is also known to increase the swelling and inflammation and cause more pain. And also you shouldn't be giving a complete rest. So maybe first initially 3-4 days the rest should be fine, but after that you need to gently keep moving the part so that there is some sort of stimulation of new blood vessels and the healing starts taking place. So we shouldn't be completely keeping it stiff in one particular position. So after first initial 3 days, then you have to start gently moving the parts. So these are the things. And if you are on blood thinners, you should be very careful, because blood thinners also can increase the bleeding and also cause more swelling. So if you are on blood thinners, please have a close look at the particular part which is injured. And straining yourself at last, and very important, straining yourself. As I already said, like some people have that habit of, okay, if it is paining, let me walk more, it might settle down, or let me run more, or let me exercise more, it might settle down by itself. That is not going to happen. In turn, you are only damaging it more and more. So always avoid straining yourself once after injury, at least for the first 48 to 72 hours. we know we have to use ice packs and heat packs in injuries, but we should also know when to use ice packs and when to use heat packs, or what are the advantages of using these two, ice and cold and heat packs. So cold packs is usually immediately after any acute injuries you have to use cold packs, because as I told, it reduces the swelling and the inflammation, and even after the exercises, so that it reduces the soreness and helps in muscle recovery. So these are the two places where you are supposed to use the ice packs. Now coming to heat packs is any chronic pain, low back pain, if you have any muscle stiffness, muscle catch. So those are the areas where you are supposed to use the heat pack, so that it increases the flexibility, and also it allows in healing of the injuries later on, not in acute stages. So this is where you have to use the heat packs and cold packs separately. Overall, if you are planning to start a sport, or if you're starting to do some exercises or getting into workout or any sort of activities like maybe running, marathon running, so what is the foremost things that you have to take care so that you don't land up injury? Any sport is associated with injury, but we are looking at only reducing the intensity or the frequency of injury. So first and foremost thing is thorough warm up, and you have to strengthen and at the same time increase the flexibility of the muscles, and hydration, as I told, very important. And your diet also has to be tailored according to your body mass index, the sport you're playing or the activity you're indulging in. So your diet also has to be tailored. Along with that, proper rest. You cannot be running every day, you cannot be playing every day. You have to play probably 5 days in a week and rest 2 days, give rest. Or maybe in that entire year, overall you have to give at least 1 month of rest to the body, so that it helps in muscles recovery and healing, so your soreness is also less. So hydration is most important, more than the diet itself. At the same time, rest and proper warm-ups is very, very important. So if you keep all these things in mind, then definitely we cannot totally prevent any injury from happening. At the same time, you should know some techniques of that particular sport or the workout, which has to be done appropriately. If the muscles are not acting in a proper direction, then definitely you will end up having injuries. So we are not completely preventing the injuries, but we are looking at reducing the frequency and the intensity of the injury. So if you follow all these things, and if you also know when to use ice packs and cold packs, and when to go to the consultant doctor, when to do primary first aid, as I told, by yourself. So if you take care of all these things, definitely the sports injuries can be reduced to a greater extent. I will be available at Aster Whitefield Hospital every day in the OPD from Monday to Saturday from 1 o'clock to 5 o'clock. So in case of any queries, you can also connect to me on Aster Health App and also directly at the OPD. Thank you.